Good morning, colleagues. For my disclosure, I receive payments for lectures from these organizations, including companies of supplements, HMOs, a hospital, and several drug companies. Did you know that the Cancer Diagnostic Institute building and Cancer Treatment Facility building of the Southern Philippines Medical Center are Mindanao's most modern cancer diagnostic and treatment facilities? Did you know that a new St. Luke's Cancer Center will rise in Asiana City, Parañaque? Did you know that the NKTI Medical Laboratory delivers the best in diagnostic healthcare and first ISO 15189 2007 accredited laboratory in the Philippines? Just imagine you can improve the survival of our patients through correct diagnosis and updated treatments. You don't need to imagine because today I will share with you new tips on cancer diagnosis and treatments. Today I will be biased. I'll be talking about technologies very much related to surgery because honestly I cannot compete with the knowledge of people in other specialties. Again, this lecture will cover new diagnostics and surgical techniques, which I think can help the audience in the management of our cancer patients. Under diagnostics, the first thing I will discuss is laparoscopy and peritoneal lavage for gastric cancer. I personally witnessed how this was done when I rotated in Memorial Sloan Kettering Cancer Center in New York City. So the main objective of this procedure is to know the presence of cancer cells in the peritoneal cavity among patients with locally advanced gastric cancer. 1 liter of plain NSS is used for lavage, after which the fluid will be sent for cytology. I'm showing you here the NCCA guidelines for gastric cancer, and you will notice the central area. This means that patients with gastric cancer should undergo the procedure. Just a reminder, in patients receiving preoperative therapy, laparotomy with washing should be considered. Positive peritoneal cytology is associated with poor prognosis. This is the study of Memorial Sloan Kettering regarding this procedure. I rotated in this hospital during my surgical oncology days under the chairmanship of Dr. Brennan. The authors found out that positive cytology as the only evidence of advanced disease which exhibit a poor outcome. Clearing of cytology positive disease by chemotherapy is associated with a statistically significant improvement in disease-specific survival. And also, the role of gastrectomy in patients with positive peritoneal cytology remains uncertain. Next topic nowadays among us surgeons is the use of indocyanine green in surgery. This is the product which is now available in the Philippines. Regarding indocyanine green, it is FDA approved water-soluble intravenous dye. it exhibits fluorescence with photoexcitation in near-infrared spectrum. If the organs are highly vascular, there will be significant fluorescence compared to surrounding tissues. In this diagram, the indocyanine green is injected to a vein. Fluorescent light is focused on the tissue using a filter camera. The surgeon can now identify the area which took up the dye. This is a picture of a liver. The right side had an indocyanine green, which means that there was good blood supply in that area. The left side remained unstained because the blood supply to that area was ligated. In this slide, we can see that the biliary tree and the gallbladder is green, which can help the surgeon perform a safer biliary surgery. We use lymphosurin dye or methylene blue in our sentinel node biopsy. But nowadays, we can use indocyanine green in this minimally invasive technique. We see here the sentinel nodes emitting the green color. The next topic I will discuss is the importance of MRI and endorectal ultrasound for rectal cancer. We need to have a clear picture of the rectal area for proper neoadjuvant treatment planning and sphincter saving procedures. We see here the anatomy of the internal and external sphincters. We surgeons aim to save the sphincters as much as possible, since we all know the inconvenience of having a colostomy. Colostomy care is a serious activity for patients. It can also limit the normal activities of our patients, and it may contribute to the depression of our patients. Inappropriate surgical planning may cause fecal incontinence, and we all know that this is a very debilitating complication. If a coloanal anastomosis was performed with damaged sphincters, then incontinence will be expected. Thus, an MRI is needed to evaluate the rectal wall, the presence of mesorectal lymph nodes, and the situation in the pelvic side walls. On the other hand, endorectal ultrasound is very good in evaluating the penetration of the tumor to the rectal wall and to the sphincters. These are the colorectal surgeons who are very good in these sphincter saving procedures. Some of them are also very good in performing endorectal ultrasound and colonoscopy. First procedure under surgical techniques is cytoreductive surgery or peritonectomy with hyperthermic intraperitoneal chemotherapy. As of this time, 3 hospitals where this is performed, namely St. Luke's, PGH, and Medical City. This cytoreductive surgery is mainly used in gynecologic malignancies and in patients with pseudomyxoma peritoneae. The main objective of this procedure is to remove all possible peritoneal implants which sometimes may necessitate resection of organs. Tubes are then inserted and the abdomen is closed, after which heated fluid with a chemotherapeutic agent is then cycled for 1 hour inside the abdomen. The tubes are removed and the abdomen is closed appropriately. The procedure is known to prolong significantly the overall survival of treated patients, although some are not agreeable to this procedure due its mortality and morbidity rates. Likewise, a 6 to 18-hour surgery with ICU admission may cost about 1 million pesos. Next is minimally invasive surgery of the thyroid cancer, of the thyroid gland. Traditionally, we see this kind of patients after a thyroid surgery. Cosmetically, it is not appealing. In the presence of new well-trained surgeons in minimally invasive surgery, thyroidectomy may be approached through the mouth and even through the axilla and periareolar region. The goal of which is to avoid creating a scar in the neck. Well, some surgeons use the robot, which provides a better view of the neck and better mobility of the instruments inside the operative field. However, it may only be performed in St. Luke's Medical City and probably UPPGH. On the left, the scar was 4 weeks post-operatively, and on the right, it shows the scar after 4 weeks. This patient underwent endoscopic surgery. Open thyroid surgery is about 200,000 pesos. Endoscopic meaning through the vestibule of the mouth or chest, it's about 300,000 pesos. Endoscopic techniques using the robot machine is about 500,000 pesos. Lastly, I will talk about oncoplastic breast surgery. I know that this was discussed already in our convention in the past. Oncoplastic surgery is most commonly performed in association with a lumpectomy. Therefore, it is done after removal of the tumor, a small amount of surrounding tissue, and possibly some of the nearby lymph nodes. Oncoplastic surgery is the performance of a bilateral breast reduction or lift to make the two breasts symmetrical. I have some sample pictures here coming from this oncoplastic breast surgery comprehensive review article. The patient on the left would undergo a breast cancer surgery located centrally in the left breast. The picture on the right is the same woman 9 months after oncoplastic surgery. She also underwent reconstruction of the nipple and areola tattooing. This patient, on the other hand, underwent an excision for a big right breast cancer. After 6 months you will notice that she retained her right breast and its appearance, well, it looks symmetrical to the contralateral breast. We have expert breast surgeons who can perform oncoplastic breast surgeries. General surgeons can also do this with the help of colleagues in plastic surgery. The surgery is not cheap, and the patient may spend 400,000 pesos for this procedure. In summary, I have discussed under diagnostics, laparoscopy and cytology for gastric cancer, indocyanine green in surgery, MRI and ultrasound for rectal cancer. And for the techniques, I have discussed cytoreductive surgery and HIPEC, minimally invasive thyroid surgery, and oncoplastic breast surgery. With that, I greet everyone. A pleasant morning. Mabuhay tayong lahat.